extra. Okay? These covers here are included in your DEXA's package, but there are other covers out here that might be more patient comfortable. I mean, this works for covering these, but there are more out there that don't have these pokey corners. Okay, so it's always advisable to try to cover your sensor, but this will only cover the sensor. There's some out there that we can cover the whole thing. Okay, so I'll show you what those look like.
Oh yeah, I know which one, like a glove pump.
Yeah, it's like a finger cot that's larger than a finger cot. Yeah, the finger cots usually have such a, because they're all rolled up, and it's a really tight end for a seal.
Yeah.
This is already open, and it's not as tight around it, and it stretches. So once you do have it in non-latex and latex. Okay. But I think that the patients like those better.
Yeah.
They're more comfortable, especially if they're real sensitive, gag reflex and stuff. This just is a lot of plastic. And you could cover the whole thing with plastic, but then you exacerbate, the fact that there's so much plastic on there. So, but this is what I include with my trainings. This shows you every part that came with your DEXA's and what fits with the DEXA's that's sold by Henry Schein, and then it has the part numbers. So if you find that you need another piece or another part or another holder, then you can just come to here and you don't have to go look it up. Okay? When you are using the sensor, there's a few things that we need to do to be careful with it. And one is don't allow this patient to bite down on the sensor or the wire. So there is out there now a wire cover that looks like a little straw almost. It's a sleeve that you could use on your air water or your saliva injector, kind of like that, and it's split. And I think it comes in like a 4 or a 6 foot length. But those you put on the outside of this, and you can either use the whole thing on it, which I've seen the offices do, and it makes it very heavy, especially if you're going back and forth. But you can cut a length off of it and use it where you think that they're going to bite. So there is that too. So if you really think that this person is going to bite on the wire, or you're having a problem with that, then you can put that over the wire. Okay? Don't drop the sensor, don't roll over it. You have chairs with rollers on it. I've seen that happen. You have a roll around over there. In 1999, we bought, my office bought DEXA's sensors, and we did everything that you could think of to abuse them. We're very good at taking care of them. So we want to make sure that take care of them by not shutting them in a drawer cabinet. So if you have this and it's laying and you start getting in the cabinet, that you're not going to slam it in here, because it starts pinching this, and that could become a problem with the electronics. If there's any sign of abuse, his warranty may be negated. So we want to make sure and follow all the directions and follow all the rules so that he still has a warranty in place. Don't clamp the sensor with excessive force like a hemostat. I'm an assistant from way back, and just put a hemostat with a single x-ray, and that's what the patient held. And we don't do that with the sensor. To sterilize it, never put it in an autoclave, and never immerse it in a cold solution. What you're going to do is wipe it with what's listed on here. And what I've seen most of is Cava wipes, because most offices seem to have that. If you don't have that and something else is listed here, absolutely. If it's listed, use it. If you have a generic brand of one of these, as long as you can match up what exactly the materials are in it, then you should be able to use that. But if it's not on that list, for sure get something that is. Okay?
Yeah, we use that copy.
You have Cava wipes? Okay.
The solution. That one.
All right, the plastics in your accessories can be autoclaved, but recommendation is to keep it in a lower setting and put them in a bag So like a 3-minute short cycle bagged. Or you could put them in a cold sterile, or you can wipe them. Okay? All right. So the next thing we're going to go over is the holders. So I showed you the holders down here. This is just pictures of how the holders go together and how they're used. So we have the posterior, the anterior, and then your bite wings. And then the green holders that we looked at to begin with, your bite wing straight arm with your circle is a cheater for your green ones. So when you're looking at it, they have little holes right here, and that's where it goes.
Oh, okay.
Okay, so if you're having a difficult time with these and trying to get an apex, this will help. Okay, especially in an endo situation where you have a rubber dam and the clamp and trying to get everything in there, and it's hard sometimes. You get cone cuts. So this will help with that. Okay, and looking at that x-ray, somebody was doing a great job on that root canal.
Good.
We can.
Good. Okay. So this is the covers I was talking about. So we can put it without a cover and then cover the whole thing, or with a cover on the sensor and then place it in there. But preferably, for me, what I've seen works is to cover with these, and this is what we were just talking about. Okay, so you know the ends are a little bit wider and they go on pretty easy. So what I'm going to simulate that today with cutting some gloves, and the tip of a glove will work the same way, but they're not as long and they tend to tear. But if you decide to get something else, then on those patients that you're really having a problem, like small kids or something, then use the end of a glove. It just seems to have more help with those patients that are really sensitive to all the plastic. Okay, you can use a bite wing tab, but very, very careful with the wire. So if you tend to really want to use a bite wing tab, suggestion would be to get that cover for the wire, or at least cut a saliva ejector, you know, and slice it and put it over the wire, because that way it will be covered. Okay. One of the biggest things to get used to when you're using a sensor as opposed to traditional x-rays, and that's what you guys did, right? You went from traditional x-rays to the sensor, is the wire. You're used to taking out the x-ray and then placing a new x-ray in a holder and just continuing like that. So on one end, this is going to be so much easier for you and so much faster, but we have to educate our patients a little bit to tell them that this is a little different, and I know you like to help us, because they hear that beep, and the minute they hear that beep, they take the x-ray out. If we can educate them and tell them that usually it's, at most of my offices, it goes to half or even less than half or more than half of what you used to be doing for your x-ray radiation, but let them know that you would like to keep it in their mouth where it's placed if it's not bothering them, so that you can immediately see where if you got the right shot. And it gives you the opportunity to then move it backwards or forwards if you're not far enough back, because you already have your starting point. So if they already take it out, or you take it out because you're so used to doing that yourself too, you've lost your starting point. So where were you to try to get back further? This way, you just have to slide it back, ask them to open a little bit, slide it back, close, you're right there. So when you're doing a series of bite wings, you just ask them to open a little bit when they hear the beep, and just relax, and then slide it forward, and you just keep doing that, and it's done very quickly. So the amount of time that it takes you to set these up, you're going to more than make up for it in not only the amount of time that you're on and off with this, but afterwards for going in and developing them. Okay, so you just have to kind of remember, especially for the first 6 months to a year with the patients that are recall and coming in, to to not only advertise how great this is for your practice, less radiation, no chemicals in the office, but try to educate them on, you know, this is going to be a little different for you. Try not to help me. Try to keep it in there until I, you know, take it out. It's kind of like going into the medical office, taking an x-ray. They ask you to sit still until they see to make sure it's okay, and then you can move. So that's what we're doing, but it's really quick too, okay? It makes it go so much faster. And they're very appreciative that doctor spent this much on them because he's worried about getting them to have less radiation and for you guys to have all the, you know, less chemicals and stuff. So it's one of those, you know, great things. Okay, so another one in here is pedo placement. Kids are very resilient, and kids love to see things immediately, so immediate satisfaction for kids is wonderful, but they do have trouble with x-rays. And this is small, a lot smaller than some of the other sensors, but it is a little fatter, and it's bigger than a pedo film. So you're going to have to do a little bit of manipulating sometimes. Some of them are really good with it, but sometimes you have to do a little bit of education for them too, and that just talks about it and how to get a modified occlusal shot and bisecting angle techniques, okay, which I'm sure all of you are familiar with, but this just kind of gives you more of a heads up with the DEXA sensor, okay? All right, so any questions so far? No. Okay, yay! All right, so when we're taking an x-ray, there's several different factors that get you a good quality. Number one is the correct sensor file installed, which we have. In our older versions, we have the sensors that have a number attached to them, and when you plugged it in, you had to select the exact one that had that number. So if this was the one with the blue little piece of tape on it, then that's the one that you're going to select. So if you had the wrong one selected, you would get a different, not as good as an image. These are all the same, for computer to computer. So even if you had 4 of these, you could use any one on any computer. So we took care of that. The other is the sensor placement. So when you're placing a sensor, it's fatter than traditional x-rays, wider this way. So you need, for patient comfort, to get towards the center of the mouth. You have more room in the center of the mouth between your palate, gives you a little bit more room than to the side where you probably have some tori or have the tongue and different things going on. Well, in that fashion, we need to, and the fact that this is very, very sensitive to minute radiations, very small radiations, that we need to get as close as we can to it. Go ahead. So have anybody used the Rin technique? You use that? Okay. And usually when you're using the Rin technique, one of the things that I've seen is you just kind of line it up. Your ring's out here and you're just lining it up, so your head's way out here too, on top of the fact that your ring's out there. So you take the picture, you got a good shot, but it's kind of light. Well, that's because we're way out here. So we need to, since we're going to turn this down, we need to get as close to the sensor, because it's going to pick up, it's very good at picking up a small radiation. And so you'll be taking a series, and one will be light because you are further out, okay, because you get that scatter, and you really want to be as close as you can. So you got to take that extra step. Once you place the sensor, you're going to slide that ring next to the cheek and then get the cone right up to the ring. Okay, and then you'll get that better contrast radiation right there. Okay? When you have the setup, we want to not see, and we don't see any dot right here. In taking an x-ray, and that's what we're going to do in your rooms to make sure where your settings are. When you're taking an x-ray and it's overexposed, you will get a blue dot. So your first x-ray, when you're looking in the view screen, on the upper right-hand corner of it, it either has no dot, which is great, a blue dot, which is overexposed, a yellow dot, which is a little underexposed, or a red dot, which is very underexposed. Okay, so when